Hello, welcome to my channel. I'm Noor. I'm one of a GP trainee based in North Wales. I'm currently in the year ST2. I'm here to give some advice on how to get into GP training and also how to pass the exams. If you haven't subscribed, please subscribe down below and like my videos if you like, and please don't forget to follow my Instagram, Dr. Noora Nazman. Let's get started. So just as a background, originally from Malaysia and graduated from University of Leeds, and I did my foundation program in the UK and then proceeded to go into core medical training and then decided to change to GP specialty training. Reason why is I quite like the GP's flexibility in the training and also work-wise, and quite a lot of route that you can go through once you've graduated from GP. In the UK, you have to finish 2 years post-graduation from medical school. There's some eligibility criteria that you can read about on the GP recruitment website, which I will link down below. In the UK, the GP training lasts for 3 years, 1 year of hospital medicine and then 2 years of GP training. It used to be 18 months and 18 months, so 18 months of hospital placement and then 18 months of GP, but they've just changed that. You can apply after completing 2 years of foundation program, so you can go straight into your GP, or depending on what specialty you wanted to do after finishing the foundation program. For the GP recruitment process, there's 3 stages. So the first one is the long listing. You apply for the application, fill in the form, they will long listed you, and stage 2 is the MSRA exam, which stands for multi-specialty recruitment assessment. Stage 3 is the selection center, which is an interview process. The dates of the application usually is announced well ahead, so if you're thinking to apply in for next August 2022, or for example if you're thinking to apply GP training for next year, then you should definitely check the website now so that you are aware of when the application is open. So they have the specific date, which is all announced on the website. I will link the website below. Currently, while I'm making this video, round 2 is about to open. Round 1, usually the application opens around November time. Round 2 is basically direct advert the jobs that was not fulfilled during the first round, and they put that in the round 2. And there's 2 rounds in a year. So the first round is obviously for the recruitment for the August jobs, and then the second round is for the February jobs. Once you fill in the application, when the application date is open, then you can book for the MSRA exam. They will email you, they will invite you to book your MSRA exam. Usually for the UK graduates, either you have to finish your foundation program in the UK, but for those who does not do the foundation program in the UK, then you can fill in the CREST form, which is Certificate of Readiness of Specialty Training. This CREST form similar to the foundation program completion. When we finish the foundation program, we get the certificate of completion foundation program, so this CREST form is kind of similar to that. And I know they've updated the latest one on the website for 2021, so you can't use the CREST form from previous years to apply for this year, so you need to use the up-to-date CREST form. Let's get into the MSRA. MSRA is actually a computer-based assessment which is done prior to someone entering specialty training. There's a GP training, psychiatry, radiology, ophthalmology, obstetrics and gynecology, community and sexual health, neurosurgery. There are 2 parts to MSRA. The first is the professional dilemmas paper, part 1, and then part 2 is the clinical problem solving paper. So it is a 75-minute assessment with 97 questions, and it has 2 types of questions covering both medical and surgical specialties. And there are EMQs, which is a standard matching questions, single best answer, and including there are some picture questions such as reading ECG, lesions, diagnosis or management of the lesions. I thought I would just give you tips on how to pass the exam and what I did and what other people did when I obviously had a discussion with my other doctor friend. There's a few question banks that you can use for the MSRA exam. The one that I used was Past Medicine, so I paid around £20 for 4 months access. It has around 2,500 questions. I did most of them, so I did complete almost the whole question bank. The other question bank that's available is MCQ Bank, eMedica, Past Test, Obviously, the price differs. MCQ Bank's quite popular as well, around £55 for 4 months. And E-Medica, about £89. It's quite expensive. And the third was PAS test. When I spoke to my other doctor friends, a lot of them recommended PAS Medicine, which I used, and actually I quite like it. I also use PAS Medicine for my other exams, so I found that it was very useful. I like the format and the explanation for each of the question. It was very useful. I suggest you go through the different question banks. They have quite a few trial questions that you can try, and then depending on which one you like, then subscribe for 4 to 6 months. So most people suggest to start studying about 3-4 months prior to the exam. I myself, actually, I booked the question bank about 1 month prior to the exam. I started doing question, but really intensive study about 2-3 weeks prior to trying to go through all the questions. Ideally, you will want to go through all the question once or twice. You will have a general idea of how the questions. I also went through the question banks by the system because I feel like that's more organized and I can focus more and study more, especially if I don't know much about that topic. Then I can put more effort into studying that topic. The exam that I did, I booked around December for the January. Just like the objective part of the driving test, Pearson Center, do the questions on the computer. The time was quite tight. I actually just managed to finish all the questions, but I think I just have like 5-10 minutes left to just go through the questions that I wasn't sure about. My advice would be, if you weren't sure about, just go with your first gut. If you think that's the most likely, then probably you were right. That's what I did anyway, and I found that my first gut usually works the best. You'll get the results 2 weeks later. Depending on how much you score, if you get more than 550, then you can go straight to the GP training. But if it's less than that, you go through the stage 3, which is the interview or selection center. I went through the selection center. I went to the interview in Hull. There were 3 stations. There's actor, there's 2 examiners in each station, and then obviously they will assess you on how you interact with the patient, how your communication skills and your consultation skills, and they will score you on that. And I was lucky to pass through both MSRA and interview exam, and I managed to get into the GP training program. My GP training is based in North Wales, which is where I was working anyway. I don't want to move. I've got family, and with kids, I just don't fancy moving when they're really established in school. That's why my first choice was the same hospital that I work in, and basically I got my first choice. If you have more questions, then please drop by the questions. I will try my best to answer them. Okay, thank you. Bye. Good luck for your GP training.